Now, a profile of a doctor who took over university hospitals in the middle of the worst health crisis in a century. Our senior health correspondent, Monica Robbins, catches up with Dr. Cliff Megerian about how the pandemic altered his vision and his priorities for the future.
Few hospital CEOs have run the gauntlet Dr. Cliff Megerian experienced. The newest hospital leader took over university hospitals in the midst of the COVID-19 pandemic. It reshaped his system vision and forced him to rethink healthcare from the inside out to accommodate the future in a post-COVID world.
We have to create a culture of trust, that we do everything we can beyond things we've ever done before to create an environment where people want to work here. We always have been one of the leaders in science and discovery, but we can't lose the opportunity to have this very rare once-in-a-100-year pandemic and not be the leaders in discovering new drugs and treatments.
A week ago, UH announced it would close the emergency departments and inpatient care at both Richmond and Bedford medical centers. The reason, they claim, is an unprecedented shortage of caregivers, specifically nurses. In order to attract and keep them, he's now rethinking job descriptions that would add to care teams.
To help take away some of the more, if you will, difficult parts of the job that other people can do. So you have to revisit and recreate the workspace to be more flexible.
Hospitals plan for pandemics, but quickly realized the need for flexibility when the real thing arrived. Now he's planning for the next one, a mental health crisis. How will patients access care when there's a shortage of mental health professionals nationwide?
What we have to do is we have to embed behavioral health specialists into our primary care base. These are called behavioral health hubs. And we've already opened the first one on the west side of Cleveland.
Telehealth boomed thanks to the pandemic proving ground.
That has allowed increased access to our providers, much more efficiency, if you will, of having that precious time of the provider and the precious time of the patient be connected. And we've gotten really, really good at that.
Pandemic restrictions modified hospital at-home programs, saving hospital beds for the sickest patients. It is the future of healthcare and why hospitals are cutting back on the need for beds.
People are going to be demanding access to healthcare through digital means, through their providers or a team of providers who are on the ready 24/7 to take care of them. So I think that you're going to see more and more care delivered at home. The healthcare environment will be something that is part of your life as opposed to something that you have to use when something goes wrong.
Monica Robbins, 3 News.